again. I've had that root canal done. Must say it wore me out. Root canals are not painful though, you know. The thing about a root canal that's bad is if your tooth is a bad tooth, like if you've got a big cavity under a filling and it goes down and gets into the root, then you get a toothache. And that toothache, they can't just give you a root canal when you have a toothache or in the filling. They have to get rid of that infection first, because if you have infection behind the tooth, up in the gum, then the tissue around the tooth is a bit swollen and loose, and also, well, generally it is, and also it won't respond to the novacane, so they can't freeze a tooth that's got a lot of pain. So if you get a toothache, the most important thing to do is to get your dentist to give you some antibiotic. And sometimes antibiotic will work, and you can just keep getting antibiotic for a while. You have to take it all. You can, because it might make it go away, and then it'll settle down and be fine. Sometimes if you need a root canal, or you have a deep filling and it's impacting on the root, it's messing up the root somehow. Enlivening the nerves, what's that called? Stimulating the nerves. Anyway, so if you get rid of the pain, sometimes you'll also get like a bump, a little lump inside on your gum, or up above your gum, where the infection is trying to drain. And if it does make a bump like that and drain, then you won't necessarily need to get a root canal. I've had a lot of root canals, but I also have one that was a very deep filling, and he thought it might need a root canal. But what happened was every now and then I would get pain, and I would get a nodule, like a little marble that would show up in there, and it would be there for a few days, and then it would go away. And so what was happening is that the pressure was being relieved. And so I haven't had a root canal there. That's been a few years now. Sorry if I'm drooling. I'm frozen on this side. See my smile? So if you need a root canal, the thing that would happen first, as soon as you have a toothache, you need to get antibiotics, because that will get rid of the toothache. And once you've gotten rid of the toothache, which takes a few days, and in the meantime you can use clove oil. Clove, you put a Q-tip into it, and you just dab it around, and it'll numb the area. That really works well for a toothache. Also, you can chew on plantain, which grows in your yard, probably. It's a regular weed that looks like dandelion. Look it up, Google it, plantain, Plantain, like that, funny banana. So when you go to get the root canal itself, you won't have any pain by then, because your infections should have all been cleared up. So then you go in and you get the root canal, and all it is a longer amount of time of holding your mouth open. So that's the only problem. They have to drill a hole through the tooth down into, through the cap filling. They don't take everything out at the beginning. You just drill a hole down through it all to get to the roots. And then from that hole, they stick in these little, you saw them on that last film, they stick in these little pins, and they're a little bit rough, and they stick it in and out, and it drags up the root that's on the inside, like the nerves that are down in those roots. And so it's all little blood vessel-y kind of things, or something, maybe not blood, but it's a little bit bloody, but you're not bleeding. And so they remove all those little things, and then they put a temporary thing in it, and they plug it up. Now my dentist, it usually costs about $500 for a dentist, for a root canal, in my dentist. This is in Ontario, Canada. But because my insurance, I had so much dental work this year, I'd used up my insurance, and so he did the second appointment, like the first appointment they do that, the second appointment they do some more of that and then they fill it. So he let me have the second appointment in January, so it'll go on this year's claim for insurance, so it's covered. That was very nice. So if you're having tooth problems and you cannot afford to go to a dentist, at least call a dentist. Maybe a dentist that you've seen, and they can probably write you a prescription and have it sent to the pharmacy. You might not even have to go into the dentist. Check it out. You might have a dentist that'll do that for you. Okay, well, that's Nancy today. Goodbye.